I extend a very cordial welcome to you, Ms. Jean Watson, in our studio today afternoon. I congratulate you also for getting the coveted prestigious International Gandhi Award for Leprosy for the year 1996, instituted by the Gandhi Memorial Leprosy Foundation. As you are working in your capacity as the physiotherapist consultant for the Leprosy Mission International, you must have traveled extensively all over the world. Please tell me why people are afraid of leprosy patients. Why do they shun them?
Firstly, I would like to thank you for your good wishes and say I am glad to have this opportunity to join in this classroom project. In answer to your question, I feel there are two reasons why people fear leprosy, and these are both associated with the deformity that is linked with the disease. The first is that the appearance of the deformity worries people, and the second is that it worries them partly because they mistakenly think they can still catch leprosy. They see the deformity and they think this is a sign of present disease, whereas usually it will be a sign of past disease.
Oh, I see. That means because the look is not aesthetic and because they equate deformity with infectivity, they are afraid of leprosy.
Correct.
And that is the basic reason of social fear. I would like to know now how these deformities are caused in leprosy.
As Dr. Noordin said, the leprosy germs like to live in the skin and the peripheral nerves especially.
That means the central nervous system is not affected, you mean?
That's correct.
I see.
If you look at this picture, you will see here the brain and spinal cord are not affected by leprosy. The nerves that are affected are peripheral nerves which go to the eyelids and the surface of the eye, to the hands and to the feet. And the result of this, if we look at the top row of the pictures, people may not blink efficiently because they have weakness in their eyelids or because their eyes do not feel. And if your eyes do not feel, you do not blink.
Correct.
In the hand, there are three nerves that are damaged. If one nerve is damaged, two fingers bend. If two nerves are damaged, all the fingers bend. It is rare for three nerves to be damaged, but if they are, the wrist will drop. In the feet, a foot may become numb and it may drop. Thus, the direct effects of damage to a nerve are threefold: loss of feeling, loss of strength in certain muscles, and loss of sweating in the skin. These problems from nerve damage are a direct result of leprosy. The second two rows of pictures show what are the risks of lifelong worsening. I would like to emphasize these risks are avoidable. And they are not a direct result of leprosy. But if, for example, you do not feel, you are in lifelong risk of injuring yourself without noticing it.
Correct.
So if your eye does not feel and you do not blink, imagine in the harvest season when you are winnowing how the dust can damage your eye.
Correct.
If, for example, you do not feel, if this is a cup of hot water, you may burn yourself and you will not be aware of the heat. You will look at your hand and see a blister, and many people say that blister is due to leprosy, but it is not directly due to leprosy. The numb hand can be injured. And if you see, because of the paralysis, when you hold the glass or you hold the hoe, all of the pressure will be on the end of the fingers. So continually there is injury through pressure, through heat, for example, to the ends of the fingers. If you do not exercise because of paralysis, then your fingers will become stiff.
I see.
So the stiffness worsens the deformity. If in the dry weather you get open skin cracks, these will cause extra problem. And if you do not feel skin cracks, and if you do not feel injury, then you tend to get infection in the wound.
Oh, you mean secondary infection?
Secondary infection,
Oh, I see.
wound infection, and if the bone is so damaged that a piece of bone dies, it may come out of the wound, and then gradually your fingers will become short through pressure injury, through wound infection. So that, for example, you see here these injured fingers eventually can become short, not because of leprosy directly, but because of extra injury and wound neglect. And in the case of the eye, if you continually damage the insensitive eye that does not blink properly, then you can even become blind.
Oh, I see.
But these problems are not a direct result of leprosy. They are lifelong risk, even after cure, if the nerves are damaged.
Oh, I see. That means you want to say that there are many cured persons, but they may be having worsening deformities if they don't take proper care of their insensitive limbs.
For example, in China, there are now about 4,000 people who have active leprosy and who are on treatment.
It's a small number.
It's a small number, but there are about 170,000, a much bigger number, who, although they are cured, have got a loss of feeling and loss of strength affecting eyes or hands or feet, and this will be giving them lifelong risk. In one area in India, where my colleagues in the leprosy mission looked at 10,000 people who had been affected by leprosy, many of whom will be cured, 1,800 of them, that's almost to 20%, had got some problem of risk which will be lifelong.
I see. Now, can you tell us as to how we can minimize these deformities?
Well, the first thing is that when people are on treatment for leprosy, those who are treating them have to watch for loss of feeling and loss of strength. Maybe somebody, when they come for treatment, already have some problem.
Yes.
Maybe while they are being treated and while there is a fight in the nerves, there can even at that time be some loss of feeling, loss of strength. And at the time when these occur, they may be reversible, but this person needs extra medicine.
I see.
Not the
What
cure
is that
medicine.
medicine?
The usual medicine is named prednisolone.
Prednisolone. It's a steroid preparation.
Indeed.
I see.
And that can help, but only if the loss of feeling have occurred within the past 6 months, is the usual rule.
Oh.
Once these problems are there for 6 months, we expect them to be there for life. So then the person with these problems has to avoid injuries, avoid skin cracks, avoid stiffness, and care for wounds so that they do not become complicated.
Oh, that means deformities are preventable by regular care of the insensitive limbs.
Well, some deformity will be there as soon as you have the paralysis, because deformity means alteration in shape. But the worsening of the deformity through the stiffness, through the shortening, these are avoidable. And some persons already have some of them, some stiffness, they have had some injury, but still they can continue to get worse.
I see.
If you look, for example, at these two photographs, here is a young man who has got some paralysis, looks as though he has already got some stiffness,
Yes.
but his fingers are not short, and he is in a plaster cast probably because he has had reconstructive surgery to help to restore some movement to his thumb.
Right.
This second picture shows a lady whose fingers are short. The difference between these fingers and these fingers is from Selfcare.
I see. Now please tell us whether this social stigma is the same all over the world, because you have traveled extensively, you have got a lot of experience. We would like to know from you.
The social stigma varies very much from place to place, even within one state, within one country. According to the local beliefs, in one area there may be a lot of fear, and in another area there may be little fear.
So it's variable.
And also variable in different races, different cultures.
I see.
For example, when I worked in Malaysia, people from Malay a race were least afraid.
Oh, I see.
People from Indian race were more afraid. People from a Chinese race were most afraid.
Oh, I see.
These pictures show how disciplined somebody must be if they have a nerve lesion. For example, somebody who does not feel in their hand must always be aware and avoid hot objects. For example, by putting this glass inside another glass, it will not be so hot.
Mm-hmm.
Or by lifting the top of a cup of tea instead of the bottom, the risk is less. So they must avoid hot things. They must avoid pressure build-up. When you are hoeing, you can continually get blisters and injury. Maybe you have to wrap something around the tool to cushion it.
Right.
They must be aware of the risk of sharp objects.
Mm-hmm.
So people must avoid injury, whether it is to the hands or to the feet. By continually walking, they must try to avoid long walks when it is feasible,
Yes,
of course.
yes, of course.
Maybe to go on a bicycle or on a cart. They should wear shoes, for example, shoes that have a very good cushioning
I see.
inside.
So that will distribute the pressure equally.
Right. Maybe sports shoes they can buy, or if they buy sandals, they should try and get some cushioned layer inside.
Mm-hmm.
And if they have a wound, for example, you see on this shoe, it is built up here. If you build up behind a wound, then you can take pressure off the wound and help it to heal.
I see.
So somebody whose skin does not sweat, for example, every day they must check their feet. If there is an injury, they must care for it. If their skin is dry, they must just rehydrate by putting it in water and then rubbing in oil. And as they rub in the oil, they exercise, so the stiffness does not occur. It is really difficult if somebody has a wound on a hand or foot that does not feel. Firstly, they need to not just put on a dressing, but think, how did I get this wound? And be a detective.
I see.
Because if the wound is from a tight shoe and they go on wearing a tight shoe, even though this wound heals, they will get another one.
Right.
So they must think how to avoid the cause, how to clean the wound and cover it, how to imagine it is painful and lessen pressure. So that, for example, if I have a wound that is not healing, maybe my husband has to go to the marketing.
Oh, I see.
Or my neighbor go to the marketing instead of me, so that I can rest my foot. And if I see it's not feeling, I know it needs more care. So the lifelong disciplines of self-care
I see.
are quite difficult for somebody to persevere in these.
Oh, that means there are ways that the community can help these disabled persons. And there must be many more.
Indeed. If you ask me, 3 main ways in which people in the community can help. The first one, I would say, is learn not to fear particularly cured leprosy. Leprosy can be very easily cured and very quickly cured, as Dr. Nordin has said. And even when somebody is diagnosed, they are non-infectious in a day or a few days on this treatment. And also people should understand that when they see this hand or when they see a wound, this is not leprosy of today, this is leprosy of yesterday. Second thing, because they understand and they do not fear, then they should reach out to welcome people. People may hesitate to come to participate in public functions like weddings,
Right.
because they fear they are not wanted. Let the person that understands go out of his way to welcome them and say, are you coming to the wedding?
Mm-hmm.
And for example, they can also give support to the person who does not feel and encourage them, how did you get this injury in your hand? Let me come and see in your kitchen. Maybe this is dangerous. Maybe you can insulate it. Maybe, for example, somebody on the foot, they have a wound, is not healing, they can offer, I will go to do the marketing for you. And I will help you you have a work which is very dangerous. You are working in a quarry and your feet don't feel. Let us as a community help you to get work like tailoring when you don't have to continue to walk.
So, thank you very much, Ms. Jean Watson, for telling us that leprosy is curable, that the deformities are avoidable. Only thing is, the person should understand what exactly he is supposed to do, and the community should also help him in having a normal life. Thank you very much.
And I say finally, let us just follow in the example of Gandhi.
Oh,
and
yes.
this medallion shows Gandhi helping somebody affected by leprosy at a time when it was not curable.
That is very significant.
Now it is curable, let us support the patient.
Thank you very much once again.